next is actually a specific tools that I advise a lot in my clinic. Okay, so this is the first photo is a 3-headed toothbrush. It calls Dr. Barman 3-headed toothbrush. It's actually in the market, but it's quite difficult to get because of the demands. So the supplier said to me, it's very difficult to put in the market because there's no much of revenue. So they started to selling only to the dentist that is actually buying and then resell again to a specific patients. So I do have this in my clinic. So this is actually a very good, practicing. This is more of a training toothbrush, and the ones that is quite severe ones already have a problems that you want to, you do toothbrush, okay? You already have a problems. So this is actually a good toothbrush for a training purposes because they have 3-headed. So when you put on the tooth head, on the tooth surface, it covers all 3 surfaces. So you don't need to do depan dulu, belakang, depan, belakang, dalam. So it can be too much of an effort for an ASD children. So if you have this kind of toothbrush, you can just put it on the one stroke. It covers all 3 surfaces at one time. You can also get this from Shopee. There's a lot of model. There's a lot of model from Shopee inside beside from this. So you can try and then implement it to the children's. Okay. In my clinic, we also do have we do lots of oral health educations. So this one Systema, I should not have like encouraged about the brand. I am no icon for any brands, but because these are actually in the market. So Systema, this one is actually vibrating at the one point. It's not rotating. The one with Oral-B is actually the rotating toothbrush. Okay. So the Systema is actually vibrating at the one point. So it's not moving left hand side. It just vibrates. Okay. So these are good tools that I use to train my children's whenever they come to clinics. Before the next visit, they want to come for scaling. So I use this one first just to get the motions of the vibrating and the humming from the battery, so that when they come next visit to me to do polishing and scaling, they have this kind of ideas. And I do encourage parents to buy this and then practice at home. So whenever they come and see me, there will be not much of a drama lah. Okay. The next one I also encourage because these children sometimes they have mood changes. Today they are not in a good mood, so they don't force. Maybe they don't want the tooth to be brushed, but the least that we can do is actually to brush the tongue. So this is actually a tongue scraper, the pink one, and the other one, the purple one, is the brush, tongue brush. Okay, so beside from teeth, actually most of the food, especially the sticky foods, and the patients who likes to keep the foods inside their mouth for a certain period of times, they have more problems on the tongues. They give this kind of order. Kita panggil halitosis. We call it halitosis. Even though there's no caries, but they always come with a crusted tongue. When you start to see the tongue like yellowish, whitish, started to become crusted, so we know that it's actually the food has stuck more on the tongue. Some of the parents also have a very prominent papillae. The tongue is not not as smooth, so they have more irregular and prominent papillae, so the food can easily get stuck there. All right, we see lots of in ASD also is a picky eater. They are very sensitive to certain texture and taste. So because I think this is one of the characteristic of the tongue that we see inside on these children. So not to forget the tongue too. If you cannot brush the tooth today, that's fine. Let's keep it for tomorrow. But perhaps you can try to brush the tongue today. Things like that. Okay. So the next one I'm going to share with you is actually the toothbrushing positions. After giving all these toothbrushing activities awareness, yes, parents have come and tell me, express their concerns. Yeah, I think I have all these toothbrush already, doctor, but it seems that it's just toothbrushing is impossible to do. Some of the parents and come to see me. It's just very difficult. They're just going to run away. They're just going to move this movement. They're just going, just impossible. All right. So these are some of the concerns that the parents told me during my clinics. So these are some of the positions that I can advise. Okay, I share with you. So I do love rapping. I do rapping a lot, and I think I'm assured that most of parents are also do much of rapping, especially when they want to give ubat, kan? When they are feverish, they want to give Panadol. They also, some of the parents also do rap, or maybe uh, do some korek telinga ke ataupun potong rambut, this kind of activities that you need their attention at least more than 1 minute. I think rapping is a way to go. So does to the toothbrushing. So I do rap my patients, and I do advise the parents to rap their patients. Just, at least for 2 minutes, a good 2 minutes where you can perform the toothbrush optimally. So the first photos, you can wrap your kid and then put it on the chair. You come from behind. Always have the other hands. It depends on which hands. Are you right-handed or you left-handed? So this is the way. The other hand has to be supporting your lower jaw. Okay? Otherwise, they keep coming down because they definitely will bring the jaw down because they always know how to run away from things. They always know how to run away from these activities. Okay? So we have to be smarter ahead, one step ahead from them. All right? So always have your the other hands to support the lower jaw so that you can see correctly, and always hold your lower chins to bring it so that you can eventually open the lower lip. And then the other hands where you have your toothbrush, you can start it working. All right? Okay, the next, you can do also on merely on the floor. All right, the way I sit down, a little bit open your feet. Okay, put them on your lap, same way, and then have one hands to support the jaw and the other hands to brush. The other one you can sit on a sofa or long sofa where these positions, and always remember one hand support, one hand brush. All right, next one. This can be also an activity during mandi, during their taking their showers. For people who have bathtub, this one techniques I learned from a parents. They put their child in a bathtub where they can, start to playing bubbles, or they feel more secure in the bathtub. They like to mandi, take their shower in the bathtub. Take this opportunity to quickly brush their teeth. Okay, in this position. All right. You can also go into the bathtub. Not with the water, just during the toothbrushing activities. Okay. And these the little ones, I do encourage patients, like for example, we just want to get them to not to move around. If the child is small enough, just get a baldi, okay, a pail, put them inside, also filled up with the water to, get rid of their attentions, play bubbles and put some ducks. At that point of time, you catch quickly, you brush their teeth, okay. And the other ideas that I can share with you, most of them are quite savvy with gadgets, and then they can actually become and then spend the attention on the gadget. So also take this opportunity to brush their teeth. Okay. So but always remember, when you want to do brushing, one hand support, one hand brush. Okay. Always have to support the jaw. Bring it up. Don't get it down. Otherwise you can't see anything, and then you might started to hurt their teeth and the tongue. Then they become angry, they become anxious, and you become more angry. They started to spit on you, and then it becomes more messy. So the tip is always bring the chin up. Okay. So the optimum toothbrushing that I can share with you, you always have to know how to work with your fingers. Okay. Because this is the only support that we have. All right. um, and we don't want to force too much and give too much of exertion force to them, so that they feel that this toothbrushing is a very hurting and no fun activities. Okay, so you have to know, always work with your hands, because your hands have the nice touch and the sensitive touch also that they need. Okay, so the first photos, when you want to brush the upper part, you have to make sure you lift up all the lip up, otherwise you can't see that properly, and then that would be not optimum. Instead of brushing the teeth, you might end up brushing the lip, and this part where you bring up the lip, there's a one we call it frenum, labial frenum here. If you don't lift it up, you might end up brushing that, and it's going to be very discomfort. Okay, you can try it on your own. If it's discomfort for you, it's going to be very more discomfort for them. So if you know what you are brushing, you have to see what you are brushing, then I think the activity would be very optimum. Okay, so this is when you want to brush the upper part, and when you want to brush the lower part, again, the other hands, bring the chin down. Okay, when you bring the chin down, automatically the lower lip will go down together with your fingers, and it will expose a little bit of the lower teeth. So that also, there is a labial frenum on that lower there, so you have to be careful not to brush that instead. Okay, and the lower ones, you can also just bring the lip outwards. Okay, don't worry, you at this point of time your fingers are not going to be bitten, as long as your fingers is always touching the lip rather than bringing it inside. Okay, so now that is for the anterior, the front tooth. Now we go to the posterior tooth. To avoid your finger to get bitten, you have to make sure, you have to be careful. Okay, these activities also can be done using, if you want to wear gloves, that's fine. But most of the ASD kids doesn't like gloves because of the texture and the smell. Okay, so you definitely have to wash your hand properly. Okay, and then the first photos, if you want to go at the back lower or at the back upper, always use one finger, jari telunjuk, to lift up the lip. You have to lift up the lip. If you don't lift up the lip, you might brush something else, and it gives more pain. Instead of brushing the teeth, you might end up brushing the lip or brushing the inner cheek, something that you're not supposed to touch, things like that. Then things are going to be very difficult. Okay, so the key is actually you have to see what you brush. Okay, see clearly the optimum as you see. That's why some these activities also is a very good for the beginners. You can put a mirror in front of you, and while you are doing all these activities, you see what you are doing. So that's the kids is also what they are doing, so that they can replicate you repetitions. By the times they are very stable enough to do, for them to do themselves, they can always replicate what you have been practicing. Okay, they might be take couples of months, okay, I might say, but it's good that whatever you do, especially in brushing, you have to show them how. Okay, so that they can replicate again. So this is for the lower teeth, this is for upper teeth. Always work with your jari telunjuk. And then if you want to brush on the upper, on the occlusal surface, okay, this is the most important surface. Two important surface in ASD, because they like to keep food inside their mouth. So our tepi ni, cheek pipi ni, like yeah, especially yang chubby cheeks tu, you have to really retract the cheek to make sure that there's no food trapped there. Then the chewing part, the chewing the surface, the chewing surface of the tooth is also very important, not to forget. Okay, good. So these are the other tips that I'm going to share with you. Is the toothbrushing modifications. I mean the activity itself. Okay, so for the parents who are actually having problems just to get your child to open their mouth, so these are some of the tricks that I shared with my with the childrens, with the parents. Okay, just get this is actually butter ice cream. You know, so today go buy lots of ice cream. Okay, collects all the batang, put it together until to the extent of it's like maybe 2 to 3 mm, maybe 4 mm, for example. Tied it up or glue it together. Okay, but make sure it's not doesn't go in the on the margin surface. So ikat dengan pun boleh, and then you balut dengan kain. So when you want to brush on the left side, for example, you put the batang on the left side, at the right side, vice versa. Okay, so this is I mean, when we able to we don't have, if they don't like it, if they don't feel like opening their mouth on that day, so we have to use something just to get the mouth open. Sometimes they just don't want it, not they are in pain. Okay, so we have to be slightly creative on to make that the mouth still open. Okay, the other way is this other photos is we use chopstick. Okay, chopstick, and then we balut, we wrap it with just some small kain, and then yet again tighten it up with the rubber band, and then do the same. So this is also a problem that we can solve if the kids don't know how to spit and gargle. I mean, to get rid of the debris of the toothpaste. So if you use a cloth and then you use a toothpaste, so this cloth is going to be able to absorb all the debris of the toothpaste. Okay, so two birds in one stone. All right. So after you just finish it, you just wash it or bilas dengan air, and then change it to the other side. You can also like soak it in like chlorhexidine a mouthwash, for example, if the patient suffering from gingivitis, the first photo that I show you, the inflammations of the gums. So you just dip it in the chlorhexidine while you are doing brushing. The chlorhexidine from the cloth can give a little bit of reactions to the area where the gums is inflamed. But bear in mind, if the kids are very sensitive to taste, so you definitely have to choose the right mouthwash. If no mouthwash is working, guna air garam pun okay. Use a salt water. Okay. So I'm sure that parents are very well informed about these visual packs. Okay, we use a lot of visual help. So I do encourage parents who come to my clinic to take photos of my clinics. I mean, starting from the front door. This is also the visit dentist punya packs. Okay, the same. So take photos. The best is not to use a cartoonish photo. It's actually is the real photo. So you take the real photo of the toothbrush, your real tap water in the toilet, and your photo of your toothpaste, so that they can really relate to the packs. Okay, so I work very closely. I work very closely with the OTs. Okay, so they do help me doing this. So whenever they come to me, they are very well behaved and well understands about brushing. Okay, so I'm very in-depth in my OT counterparts. They really help me a lot whenever I have problems with my patients who actually doesn't want to open their mouth and brush the teeth.